No light. This one. Okay. The choice of death. In life, we're always told that we have many freedoms and liberties afforded to us. But is that really a true and accurate statement? I support assisted suicide because there comes a time that we all may have to go through a situation where there's extreme pain or terminal illness involved. I've seen cancer patients and others that were in extreme pain and wanted relief in any way that they could get it, especially knowing that their days were short. First, I will go over what is assisted suicide. Secondly, I will tell you how people in general feel about it. And lastly, I will go over some reasons for assisted suicide. And remember, there are many things that people go through, and certain things run through your mind in different situations that can change your outlook on everything. You may ask, what is an assisted suicide? This is not considered euthanasia. Euthanasia is when a doctor actually administers those drugs to you. Or even, you wouldn't think of it, but it's actually a time where if your heart stops in the hospital and the doctor doesn't try to revive you. As a society, we do not think about going to the hospital and signing that do not resuscitate document as euthanasia or assisted suicide, and we don't think of it as when somebody pulls a plug. There's nothing wrong with that. It's accepted in society. But if you really think about it, we're doing the same thing. In assisted suicide, the patient is provided the lethal dose by the doctor, and the patient takes the dosage themselves. The doctor does not administer it. The patient makes that decision independently from the doctor. Some would say by definition, euthanasia and assisted suicide are the same thing though. This is a compelling argument, but some may still need help in deciding which is which. How does society in general feel about it, you may ask? An overwhelming amount of people think that assisted suicide is acceptable. According to Death and Dying, End of Life's Controversies, written by Gale, published in 2007, doctor-assisted suicide has a 58% approval rate. Assisted suicide is more accepted, even more so than you would think, however. Several countries, the Netherlands, Japan, Colombia, are all in favor of assisted suicide. The Methodist Church and the United Church of Christ, both are in favor of assisted suicide. That's something that most people wouldn't understand or even know. The one thing we are sure is that everything in life has benefits. Assisted suicide is something that does not want to be discussed, but it does have its benefits. Some of the supporting benefits of assisted suicide are as follows. The patient's tremendous amount of pain and suffering will end. The patient dies with dignity, knowing that it was their choice and not the disease's choice to take them out. And also, the vital organs can be preserved to help someone else, save someone else's life. These things may sound harsh, but if you step back in reality and take a look at it, there are also great benefits to assisted suicide. First, I told you what assisted suicide was. Secondly, I went over how the general public feels about it. And lastly, I gave you some supporting reasons for assisted suicide. There are a lot of things that we see in this world as harsh, but in the right situation, assisted suicide is something that we all should accept and understand that it's your choice. Everything is your choice. Remember, it only takes one to start. And reading the article, Assisted Suicide in the United States for Opposing Viewpoints in Context by Gale, the state of Oregon passed the Death with Dignity Act in 1994. Since that time, 24 people have purchased the lethal dose of prescription drugs for an assisted suicide. Thank you. Get them again?
Angela's no. The answer is no.
Turn it
Thanks.
Okay, we're good.
Keep your last up.
What? I bet you that would be you.